By the time many people hit their 60s, bloodstream highways can narrow and slow, resulting in cold hands, low energy, and wounds that take longer to heal. That slowdown isn't just annoying. It changes how your whole body feels day to day. A surprising ally lives in most kitchen cupboards: baking soda. Scientific studies and exercise research suggest sodium bicarbonate can neutralize excess acidity, help tiny vessels relax, and improve how blood moves through aging tissues. Watch closely and you'll get the plain language science behind that claim, real-life examples of people who felt a difference, safe ways to try small, diluted doses, and crucial warnings about sodium and medications. Stick around for a quick demo you can adapt to your routine and 3 safety rules every person over 60 should follow before trying this at home. 1. The hidden danger of poor circulation in seniors. Cold, numb toes and wounds that refuse to close are more than minor annoyances. They are common indicators that blood isn't reaching tissues the way it should in older adults. Reduced circulation in seniors often presents subtly: tingling, persistent fatigue in the legs after short walks, or swollen ankles that improve with rest. But these early signs can mask serious underlying problems. When oxygen and nutrient delivery to tissues falls, cells struggle to repair themselves and infections gain an easier foothold. Several medical conditions typically underlie poor circulation in the elderly: narrowing of the arteries, peripheral artery disease, diabetes-related small vessel damage, chronic venous insufficiency, and occasionally blood clots that block flow. Sensory loss from diabetic neuropathy can hide injuries, making a small cut on the foot go unnoticed until it becomes a deep ulcer. For example, a seemingly minor blister from a tight shoe can evolve into a non-healing wound when blood flow is inadequate and the immune response is weakened. The consequences are not just discomfort, they are practical and urgent. Slow-healing ulcers raise the risk of bacterial infection, and infections in poorly perfused tissue are harder to treat with antibiotics. That combination can lead to tissue death and, in severe cases, amputation. Cardiovascular risk also rises because the same arterial problems that reduce leg circulation often reflect wider atherosclerosis, increasing the likelihood of heart attack and stroke. Mobility declines as pain and swelling limit walking, which then accelerates muscle loss and further worsens circulation in a dangerous downward spiral. Addressing poor circulation requires both medical assessment and everyday actions. A clinician can perform bedside tests like the ankle brachial index or order Doppler studies to map blood flow and identify blockages. Treatment may include risk factor control, tight glucose management for diabetes, blood pressure control, lipid-lowering therapy, and targeted interventions such as supervised exercise therapy, compression for venous problems, or revascularization when blockages are significant. At home, regular foot inspections, proper footwear, avoiding tobacco, keeping legs warm, and light daily walking can all improve symptoms and reduce complications. Do not wait for pain to become severe before acting. If persistent coldness, numbness, non-healing sores, or sudden swelling appear, reach out to a primary care provider or vascular specialist promptly. Early detection and a coordinated plan that combines lifestyle changes with appropriate medical care significantly reduce the hidden dangers of poor circulation and protect mobility, independence, and overall health. 2. Why blood thickens as we age. Aging changes the internal chemistry of blood in ways that make it more prone to coagulation and slower to flow. Chronic, low-grade inflammation raises proteins such as fibrinogen and other acute phase reactants, and those proteins increase plasma viscosity. Endothelial cells that line blood vessels lose some of their ability to produce nitric oxide, a key molecule that keeps vessels relaxed and platelets from sticking. The combined effect is a circulation system that resists smooth flow. Many processes contribute to this shift. Persistent oxidative stress damages the vessel wall and promotes platelet activation. Metabolic conditions common in later life, type 2 diabetes, insulin resistance, and dyslipidemia, change the composition of plasma so it carries more sticky lipoproteins and glycosylated components, which increases bulk and stickiness. Kidney function often declines with age, altering fluid balance and sometimes concentrating the blood. Dehydration, even mild, magnifies viscosity further. Medications, sedentary habits, and smoking add cumulative risk. For a person living with diabetes, for example, higher blood glucose favors glycation and platelet hyperreactivity, making clots more likely. For another who is frequently dehydrated after long days outdoors, a temporary spike in hematocrit or plasma concentration can feel like thicker blood on a literal level. There are practical ways to counteract many of these mechanisms. Improving endothelial function through regular aerobic exercise increases nitric oxide availability and lowers resting platelet activation. Dietary shifts that reduce processed carbohydrates and increase omega-3 fats and antioxidants lower systemic inflammation and help normalize plasma composition. Staying well hydrated keeps plasma volume steadier and prevents transient rises in viscosity. Medical strategies, discussed with a clinician, may include tighter glucose and lipid control, statin therapy for its anti-inflammatory benefits, and antiplatelet or anticoagulant approaches when risk profiles indicate. Routine testing of markers such as fasting glucose or HbA1c, lipid panels, C-reactive protein, renal function, and basic clotting indices can reveal which pathways are most active in any given person. Translate these ideas into daily habits and monitored steps. Start the day with water, build movement into routines with brisk walks or cycling. Choose whole foods rich in fiber and polyunsaturated fats, and avoid long periods of sitting that slow circulation. Check in with a healthcare provider about blood tests that assess inflammation and clotting tendency, and review medications or supplements that might influence viscosity. Small, consistent changes reduce the processes that thicken blood and make medical therapies more effective. Reach out to your doctor to review your risk factors and create a plan tailored to your health. Proper testing and a clear action plan are the next best steps. 3. The science behind baking soda and pH levels. Sodium bicarbonate is a major player in the body's extracellular buffering system, and its chemistry explains why it can alter blood pH quickly. When bicarbonate, HCO3, meets hydrogen ions, H+, the pair form carbonic acid, H2CO3, which reversibly converts to water and carbon dioxide that the lungs expel. This equilibrium, CO2 plus H2, OH2CO3, H++ HCO3, is the backbone of acute acid-base regulation. Increasing circulating bicarbonate shifts that equilibrium toward fewer free hydrogen ions, producing a measurable rise in plasma pH. The lungs and kidneys then act to stabilize the change. Ventilation adjusts CO2 removal, and the kidneys modulate bicarbonate reabsorption and acid excretion to restore long-term balance. Older adults commonly experience a subtle, chronic tendency toward lower systemic pH because renal acid excretion and dietary patterns change with age. That low-grade acidosis is not dramatic, but it alters cellular behavior in vascular tissue. For example, an acidic environment can reduce endothelial nitric oxide availability. Nitric oxide is a key vasodilator produced by endothelial cells and can also increase oxidative stress, both of which blunt vessel relaxation. Small shifts upward in blood bicarbonate after ingestion of sodium bicarbonate can therefore relieve proton-driven inhibition of vasodilation, improving the capacity of vessels to widen when tissues demand more flow. On the molecular level, pH modifies several mechanisms that determine flow. Hemoglobin's oxygen-binding behavior is pH-sensitive. The Bohr effect: lower pH favors oxygen unloading in tissues. Higher pH tightens oxygen binding. Meanwhile, red blood cell deformability and the rheological properties of blood respond to hydrogen ion concentration. Acidosis tends to make red cells less pliable, increasing microvascular resistance. Smooth muscle tone in arterioles is also proton-sensitive. Proton-gated ion channels and pH-dependent signaling pathways change calcium handling and contractility. Taken together, modest extracellular alkalinization via bicarbonate can reduce peripheral resistance by improving endothelial signaling and microcirculatory dynamics, even if oxygen-binding characteristics shift slightly. Practical integration requires balancing benefits and risks. Correcting a measurable bicarbonate deficit under medical supervision has been shown in clinical settings. for example in patients with metabolic acidosis secondary to kidney disease, to improve markers of vascular function, while unsupervised sodium loads can raise blood pressure or cause fluid retention in susceptible people. Dietary tactics that lower net acid load, more fruits and vegetables, less excess animal protein, work alongside buffering strategies to support a healthier pH milieu. Athletes exploit the same buffering chemistry to delay muscle fatigue during high-intensity bursts by increasing extracellular bicarbonate transiently, illustrating how raising bicarbonate changes both local metabolism and perfusion dynamics. If you suspect low-grade acidosis or want to explore buffering interventions for better blood flow, the sensible step is a measured one. Check basic labs, serum bicarbonate, electrolytes, kidney function, and discuss options with a clinician before starting any oral bicarbonate regimen. Small, medically guided adjustments to pH can translate into clearer endothelial signals and smoother microcirculation, but they should be integrated with dietary changes and monitored to ensure safety and sustained benefit. 4. Safe dosage. Myth versus medical reality. A single teaspoon of baking soda delivers a surprisingly large sodium load, and that simple fact explains why self-prescribed dosing can be risky, especially after age 60 when blood pressure, kidney function, and medication lists often change. Many people assume that because something is sold as a kitchen staple, it must be harmless in any amount. Yet the body's electrolyte balance is delicate and easy to disrupt. Short-term use as an antacid is common, but using baking soda regularly to alkalize the body or improve circulation can produce measurable physiological effects that require medical oversight. People often try homemade regimens with vague measurements, thinking more will equal more benefit. In medical reality, dosing matters because sodium bicarbonate affects blood volume, acid, base balance, and drug clearance. When clinicians prescribe bicarbonate, most commonly to correct metabolic acidosis, the dose is calculated from laboratory values and adjusted by monitoring serum electrolytes and bicarbonate levels. Hospitals use intravenous formulations under careful supervision. Oral over-the-counter antacid packets are standardized and labeled for short-term symptom relief, not for chronic blood flow enhancement. Side effects that arise from inappropriate dosing are not just theoretical. Excess bicarbonate intake can lead to metabolic alkalosis, which may present as muscle twitching, lightheadedness, or altered mental status in older adults. Fluid retention and worsening hypertension are real concerns because the extra sodium can increase blood pressure and strain the heart. Patients with chronic kidney disease, congestive heart failure, or those on sodium-restricted diets are particularly vulnerable. In addition, altering systemic and urinary pH can change how some medications are absorbed and eliminated. That means interactions with diuretics, certain blood pressure drugs, and medications cleared by the kidneys may become clinically important. Practical steps reduce risk and integrate baking soda use safely when appropriate. Always compare any home dosing against product labels and never invent a regimen based on internet anecdotes. If a physician considers bicarbonate therapy appropriate, they will specify form, dose, and monitoring. Check blood pressure regularly, measure body weight for fluid retention, and order periodic blood tests for electrolytes and renal function. Pharmacists can review potential interactions with existing prescriptions and suggest timing adjustments or safer alternatives. For older adults seeking better circulation, clinicians usually prioritize proven measures: blood pressure control, exercise, smoking cessation, and medication management, over unproven supplemental alkali. Talk to your healthcare provider before trying baking soda beyond occasional antacid use. Bring a complete list of medications and any supplements. Ask whether you need baseline blood tests, and request written dosing instructions if bicarbonate therapy is recommended. If you notice swelling, rising blood pressure, or unusual weakness after starting any regimen, stop the supplement and seek medical advice promptly. Small steps, guided by medical reality, keep you safe and preserve the potential benefits of any treatment. 5. 3 other natural blood flow boosters. Blood vessels lose some of their elasticity and the cells that line them become less effective at making nitric oxide as we age, which makes poor circulation a frequent complaint after 60. Good news, simple dietary choices can restore part of that lost responsiveness. Here are 3 natural approaches that work through different but complementary mechanisms, each one supported by physiological pathways and real-world experience. Dietary nitrates from beetroot and similar vegetables convert in the body to nitrite and then to nitric oxide, a potent vasodilator that relaxes vessel walls and helps blood flow. Athletes often use beetroot juice to enhance stamina before exercise because it supports oxygen delivery to muscles. Older adults may notice less leg fatigue when they include nitrate-rich vegetables in meals. Try roasted beets tossed into salads, a small serving of beet-based juice before activity, or powdered beet supplements if fresh vegetables are hard to manage. Be mindful that a sudden drop in blood pressure can occur in people on antihypertensive therapy, so monitor levels and consult a clinician if you're taking blood pressure medications. Omega-3 fatty acids from oily fish and plant sources improve endothelial function and reduce blood viscosity and platelet stickiness, all of which help blood move more freely through narrowed or stiffened vessels. Incorporating fatty fish into a couple of meals per week, or adding plant-based omega-3s like ground flaxseed and walnuts to breakfasts and salads, are practical ways to boost intake. Supplements are another option, and many older adults find them easier than changing long-standing eating patterns. However, high doses can increase bleeding risk, especially when combined with antiplatelet or anticoagulant drugs, so check with your healthcare provider before starting supplements. Garlic contains bioactive compounds that support vascular health by promoting vasodilation and reducing platelet aggregation. Aged garlic extract, in particular, has been used in clinical settings to support circulation. Simple culinary tactics: crushed raw garlic in vinaigrettes, roasted garlic blended into soups, or standardized aged garlic supplements can all be effective. People taking blood thinners should be cautious because garlic can enhance anticoagulant effects. Coordinating with medical supervision is important. Start small and practical. Add one nitrate-rich dish, one omega-3 meal, and one garlic-based dressing across a week. Then observe how your energy and limb warmth respond. Pair these dietary shifts with gentle daily movement and hydration for magnified benefit. Finally, always check for interactions with prescription medications and get periodic blood pressure checks. Try one change at a time for a few weeks, and then reassess with your clinician to build a safe, personalized plan that boosts circulation naturally. 6. CTA: when to consult a doctor before trying. Sodium bicarbonate raises the body's sodium load and shifts acid-base balance, and that matters more as kidney function naturally declines with age. Many people over 60 take multiple prescription medications and live with chronic conditions that make even small changes in sodium or pH risky. If you have reduced kidney function, heart failure, or uncontrolled high blood pressure, talk to your doctor before trying baking soda, because it can worsen fluid retention and disturb electrolytes. People on certain medications should be cautious. Diuretics, especially loop and thiazide types, change potassium and sodium levels. Combining them with sodium bicarbonate can accelerate electrolyte imbalances. Lithium is another clear example. Changes in sodium handling alter lithium excretion and can lead to toxicity. Some drugs need an acidic stomach for proper absorption, certain antifungals and iron supplements among them, and baking soda can blunt their effect by raising gastric pH. Always bring a complete medication list, prescription, over-the-counter, and supplements to your appointment so your clinician or pharmacist can assess interactions. Your clinician will usually want objective checks before giving the green light. Expect blood tests such as serum electrolytes and kidney function, creatinine or estimated GFR, and a blood pressure check. They may advise trying only a short, carefully measured course with close follow-up or suggest alternative, safer strategies to support circulation. Watch for warning signs at home: new or worsening swelling, sudden shortness of breath, unexpected weight gain, persistent nausea, muscle twitching or weakness, tingling around the mouth, or heart palpitations. These can indicate fluid overload, electrolyte disturbance, or metabolic alkalosis and should prompt immediate medical attention. If you're considering baking soda to affect circulation, do this first. Consult your primary care provider or a pharmacist before starting. Be explicit about chronic conditions, heart, kidney, liver, dietary sodium restrictions, pregnancy or breastfeeding, and all medications you take. If a clinician approves use, follow a recommended dose, monitor symptoms and vitals, and arrange for follow-up blood work. And if any concerning symptoms appear after beginning it, seek medical advice promptly rather than waiting. If you're over 60 and worried about cold hands, fatigue, or slower recovery, here's the bottom line. Aging often slows circulation, and small shifts in your body's acid-base balance can influence blood vessel relaxation. Baking soda may help some people by temporarily changing that balance, but the evidence is limited and it's not a substitute for medical care. In short, 1. The problem: circulation often declines with age. 2. The possible solution: sodium bicarbonate can alter acid-base chemistry and might improve short-term blood flow in some cases. 3. The caution: this isn't universally safe and can affect blood pressure, medications, and kidneys. Always check with your doctor before trying it. If you decide to explore this, integrate it carefully. Talk to your healthcare provider, review your medications, start only under guidance, and combine any approach with proven steps: regular walking, leg exercises, a heart-healthy diet, hydration, and quitting smoking. That combination is what really moves the needle. If this video helped, please like, share, and tell me in the comments if you or a loved one have tried baking soda or other circulation tips. Subscribe so you don't miss the next video where we'll cover safe dosing considerations, doctor perspectives, and daily habits that boost circulation after 60.